This is our sixth panel of the Texas State of Enrollment Conference. Like I mentioned, we're going to focus on the assister workforce with people who are in it on the day-to-day. These are the folks who are going to be able to join us. I hope Anel is here, maybe, or maybe can join later, but we've got Daniel from United Way Dallas, Jeanette from Boat People SOS in Houston, you from Light and Salt, which serves many counties across Texas, from Harris to Travis at least, and more. Monica Garcia and Jennifer Martinez from MHP Salud, and Anel Trevino from the Bexar County Health Collaborative. Longtime assisters, longtime experts, and just very well tapped into to the things that this community experiences on the day-to-day. And I'm hopeful that this panel can be an opportunity for venting, for sharing, for learning a bit about the things that are happening across the state, and then really also as a springboard for future conversations, for network building and coalition building, not just during the open enrollment period, which is coming up, of course, but afterwards as well, throughout the year and persisting into the future. I think one of the things that happened over the course of the last 4 to 5 years, because there was so much communication and eligibility and enrollment, and really, I think, just general infrastructure upheaval and review during the COVID-19 pandemic or the public health emergency. I really think it gives us an opportunity to see which of those pieces of changed communication styles or network building, which of those things we want to last into the future. And I'm hopeful that this conversation can be part of that ongoing assessment of what our assister community needs in Texas, and how organizations like Every Texan, like Young Invincibles, and I think also like the Texas Association of Community Health Centers, like our sponsors, St. David's Foundation and Methodist Healthcare Ministries, can best support the folks who are doing the work and helping people get enrolled and helping folks use programs like Medicaid, like CHIP, like SNAP, like Marketplace Health Insurance. So I just wanted to start with a reality that everybody should know about, that's going to affect assisters moving forward into the open enrollment period for 2025 coverage year health plans. So this topic is not necessarily relevant to folks who help only with Medicaid or CHIP or Medicare savings programs or SNAP applications, but still really important things for everybody to know about, even if you're not working with folks, with community members on the healthcare.gov application. So if anybody remembers pre-COVID, in case that time is still alive for anybody, we every year, sometimes when we were helping people enroll in Marketplace health insurance plans, self-employed people who work for small businesses, folks who don't have an offer of employer coverage and who don't have Medicaid or CHIP, which is most adults in Texas, who don't have those offers of employer coverage. If somebody didn't reconcile their tax credits, so if the IRS was helping them pay for their health insurance plan in, let's say, for instance, right now in 2023. So right now we're in the 2024 coverage year. So say I have Marketplace and I've had Marketplace for 5 years because I work for a small business and they don't offer me health insurance. In the past, pre-COVID, if I had not yet filed my 2023 taxes, which makes sense, some self-employed people don't file their taxes until October. They file an extension, they do their taxes in October. And so if people either had filed an extension and had not filed their taxes before October, or if people did file their taxes, but they forgot to file with Form 8962, then when they fill out their Marketplace application for the next coverage year, so let's say in this example for 2025, then they get this notice popped up on their eligibility letter that says you're not eligible for tax credits. And this could be why, right? It could be because you don't make enough money. It could be because you didn't file your taxes, or you didn't reconcile your tax credits last year. So what happens is the IRS does what's called a failure to reconcile check, or an FTR check, around October every year before Marketplace enrollees need to go on to the next coverage year. So again, if I didn't file my 8962 in April, or if I extended my tax forms to October, then most likely when healthcare.gov gets with the IRS to do that FTR check before the upcoming open enrollment period, they'll know that I didn't reconcile. So I'll get that eligibility letter that says you can't enroll with tax credits. You have to buy a full price plan. Which of course is really tricky during open enrollment because it's hard for people to find somebody to help them do their taxes or to help them amend their taxes during the open enrollment period. So those folks would have to do a little bit of scrambling. They would have to go find a tax preparer or figure out how to amend their taxes on their own. Or you can check that box on the marketplace application that says, oh no, I did file my taxes. I did file my 8962, right? And if you check that box on the application, then the IRS will do another failure to reconcile check after open enrollment right around February. And so if somebody has failed to reconcile, but they check the box on the application, then they'll get tax credits for January and maybe February. But when the IRS does that second FTR check, they'll lose their tax credits again, unless they filed their taxes or they amended their tax returns to include their 8962. So that process is starting up again. So the IRS and healthcare.gov in October are going to perform an FTR check, and they're changing the policy now. Instead of people needing to make sure, I mean, people need to file their 8962s every year regardless. That's the main messaging point that assisters should use when they're talking to people about reconciling their tax forms. But now moving forward, the IRS is not going to prevent somebody from enrolling with tax credits unless they have failed to reconcile for 2 consecutive years. So in the last example, I would have, if I'm the person who didn't reconcile my 2023 tax forms or my 2023 tax credits, I would have had to have also failed to reconcile in 2022 in order for me not to get tax credits leading forward into 2025. So the process gives people a little bit of leeway. I just want to make sure that everybody knows that this is going to happen again moving forward. And again, the best thing for clients to know or for community members to know is you do have to file your 8962 when you have marketplace health insurance, but it's a little bit different moving forward in that people do have a little bit more leeway, a little bit more flexibility as far as forgetting maybe to file that 8962, because now we have multiple years in a row that have to be missed before that person doesn't get tax credits moving forward. So this box is a little bit fuzzy, but it was the only screenshot that I could find. Since we're not in open enrollment right now, you can't see this part of the application. But this is what it'll look like on the marketplace application when assisters are talking with somebody who, by the time they get through the application, they get the eligibility letter that says you don't qualify for tax credits. But they can go back on the application and check this box if they actually did file their taxes or if they amended with their 8962. So does anybody have any questions about that process for moving forward? Has anyone already developed any materials for patients or clients? And if you have, raise your hand. I'm going to stop my screen share so I can see everybody. Oh, Isra, I just saw your messages. Thanks for that. You says, yes, for the past 2 years, the biggest challenge is that agents change the plans without consumers' consent. Okay. Oh, gotcha. So we're talking about agent broker fraud now. Cool. We can definitely go back to that. Awesome. Okay. So it looks like we're all good then on failure to reconcile. Well, the question is already posed about agent broker fraud. Joe says he's shaking his head because those issues with agents and brokers is going to be wild. Does anybody on this call, Jennifer, Daniel, Monica, Jeanette, what kinds of talking points do you have for the agent and broker issue moving forward? And could somebody just also, so folks don't just have to hear me talking, just give a quick rundown of the situation? Like, could anybody just speak for like a minute and a half about like what's been happening for the past couple of years? Does anyone feel comfortable?
Yes, Lynn, I'll go. So this is Jennifer at MHP Salud. I do want to speak a little bit about that because I think it's very important that everybody is aware of the resources that are available in order, I mean, in what resources that go into reporting agent and broker fraud. We do have, state resources that we can report, what is happening with consumers, but also take it another step forward is working closely with CMS as well. We're Navigator grantee, so we do keep our project officer abreast of any issues or any major issues, any themes, any trends that we are seeing out in the community, because this is real. And I am sure that I'm not the only one that we're not the only program that is seeing consumers sign up for, consumers that have plans in which they were unaware that they even had. They were unaware that they even had these, the subsidies, the help from the government, and then they're surprised when we help them out with their 1095s. So it's very important that, we talk to our assisters in, what to look for, and that we also share what process they need to take in order to report this agent and broker fraud.
Thanks, Jennifer. Yeah, and Maria just put into the chat. It sounds like agents and brokers have already started calling consumers to enroll for 2025. I see you just unmuted.
Yes, and yeah, we know how to report the fraud to TDI and to the CMS, but things didn't change better. It even worse in the last year. The first year is the 2022, and the 2023 is the second year. We will see if this year will be better. And the agent changed the consumer's plan without the consumer's consent, and the consumers even didn't aware that the plan was changed. And we have a consumer is a cancer patient, and when the consumer plan to see the oncologist, he found that the plan was changed and the oncologist didn't accept the new plan. So the consumer need to change the plan back to the previous one, and it affected a lot. So it didn't change better for the second year. We will see how about this year.
And the other thing I wanted to add on to that is that a lot of times the community members think that it's okay for these agents to do that, right? Because they say they have all of their information, their user ID and their password. And so a lot of times when things are changed, they're thinking that that's something that the agent can do, and that is not true. And that's why, reporting this fraud to TDI, a lot of times clients also don't want to do that because they don't understand that their information, should be kept private and is for them, but they have a choice to tell them that the agent can't do that. But a lot of community members don't know that. And so there's a lot of education that we have to do, in our own community, because it's almost like because they speak the language, right? And they trust, the people who speaks that language and think that they're doing the good for them when it is not.
Oh, and one more thing, the agent can access consumers' account more easily. The only thing is name and date of birth. As long as they have the name and the date of birth, they can access the consumer's profile. They have different platform than us. If we want to access the healthcare.gov, if we don't know the username and password, we cannot access. But for the agents, it's very, very easy. Only name and the date of birth, they can access everything, including the social security number. So that's unfair. That's unfair for the navigators. If we don't know the username for the consumers, we need to call the marketplace call center. It may spend like 1 hour to retrieve the username and password. But for the agents, only name and the date of birth they can access.
Yeah, thank you so much, you. Those websites are called enhanced direct enrollment websites or direct enrollment websites. They include Benefit Align, Health Sherpa. If anyone is signed up for the
Sherpa, yeah,
Texas
Sherpa.
Health Sherpa, yeah, if anyone
Mhm.
is signed up for the Texas Outreach and Enrollment Digest, I just sent a link out where assisters can go to verify which EDE websites exist so they can confirm with their clients whether or not they're possibly getting enrolled through one of those. Because when you pull up somebody's account on healthcare.gov, sometimes it'll give you that little warning that says like this person's application was last accessed through Health Sherpa or whatever. And so you know that somebody was using one of those direct enrollment websites to get into their application. And Tracy, or no, not Tracy. Somebody just mentioned, it was Maria in the chat said, why would they make it so easy for agents? It doesn't make sense, right? And you're right, Maria, like it doesn't make sense from the perspective of nonprofit assisters, like everybody on these calls. But the reality is that when the Affordable Care Act got set up, there was a lot of private industry. There was a lot of the insurance lobby and the insurance agencies lobbies that were there saying, how can we make this system profitable for us, right? Like, how can insurance agents and brokers and also insurance companies make a lot of money off of this system? And so when the establishment of the Affordable Care Act and the establishment of our marketplaces, Daniel, I see your hand, when these things got started, they all got started with that idea in mind. And so, yes, the other comments that are in the chat right now, like from Maria Salgado, like education is very important to our community. We need to explain to them the difference between agents and brokers. Yeah, I think that's definitely another topic that we can get into here in this conversation, but I'd love to shift over to Daniel.
Yeah, thank you, Lynn. So number one, it's just really exciting to be in this room with all you incredible people doing this work, getting ready for a new open enrollment. I do want to say there's great comments on the chat, and I want to echo that education, at least I believe, education is key to the success and the process of the enrollment process. So what does that look for our navigators, and talking about how do we give our navigators the tools that they need to then share those tools with the consumers that we're helping as part of our enrollment process. Our navigators, because of these frauds, Lynn, we started adding that education piece in every enrollment process. Daniel, will be the only one calling you to check on you. If I am not calling you for whatever reason, someone from United Way will introduce themselves as United Way representative, right? Like, so what are those key pieces of education and information that will help your consumer protect themselves, right? Because the challenge here, Lynn, with the fraud that we have seen over and over and over again, year after year, is that there's no uniformity in the way that the fraud is executed, right? Could be a different plan. Could be that they're changing the same insurance company, but a different plan that it costs a little bit more, right? So we have seen fraud in many different ways, and that makes it very challenging to identify. But agree to some of the comments here. When we give our consumers the tools that they need to protect themselves with the education, it really adds a layer of protection, and it is a way of preventing, right? Like, we can't stop at 100%, but it is definitely preventing. And the other thing that I was going to say, as part of our training for our navigators, is to really show them the steps that they need to follow to submit these frauds. And you know, just echoing what you said, make sure that they submit that Texas Department of Insurance application, right? Like, start with the process to help our consumers. I know that Joe put a comment on the chat. It makes it really difficult. Once that fraud is made, I mean, we have seen it again over and over with our consumers. a consumer, I'll give you a quick example, signed up for Baylor Scott and White last year with one of our navigators, but somehow in a couple of weeks, he was not enrolled in Baylor Scott and White anymore. He was United Healthcare, and he had no idea. Right. So then we started digging the information of how do we end up here? Right. So it is a long process to the point that unfortunately the consumer did not have health insurance for the first month of the year because it was a complete mess. So I think that all of those cases have really put us in a position that we have to prevent it. And one of the ways, which again, great comments in the chat, it is education. How do we have our navigators just share that education piece? But anyway, I know we have many other things to discuss, Lynn, so I'll pass it back to you.
Yeah, that's brilliant. Thank you, Daniel. And Monica, I saw your hand up.
Yeah, just really brief. One of the things that as an MHP Salud, as an organization, we work and we are led by the community health worker profession. And so these are our navigators, and they're in the field, and they are trusted members of the community. And so part of that is that our CHWs are providing that in-depth education. They're able to connect the community to resources. So that starts to build trust, right? And then we use language within our marketing materials. We use language when we're in the field to identify ourselves as different from the agents and brokers. Like, who are we? Why are we here? And so that's part of the educational piece that our CHWs are doing. I just shared a link to our website. But I just wanted to reiterate that as an organization, what it is that we are doing as an organization to dispel this misinformation that is being shared in the community. Our CHWs are the frontline workers that are part of our organization that are really supporting this process and making sure that our community is fully informed on this.
Yeah, I love that. Just like, getting the mouthpieces to be the people who are in the community who know the folks, right? Like building that trust up, making the education palatable, making it understandable on a day-to-day basis. And Connie just put into the chat that agents and brokers are targeting English as a second language communities and immigrants also. Didn't know that people got switch plans until they received a new ID card, right? It's all so confusing for these community members. We've heard from assisters in other states that the target populations have been like people on Ryan White policies, right? So people who have like very high medical conditions. And like Daniel said earlier, there doesn't seem to be any rhyme or reason to it, except a bad actor identifies a vulnerable population and says, I'm going to go for it. Which is just awful. And I want to just echo what everybody on this call has said about education, and also just emphasize that there is new regulation also. I think like one second part, or one supplement to client education can always be like regulatory change from CMS. And I'll put a link in the chat here that I'm pretty sure most folks on this call know about, but just in case not, in July of this year, the Biden administration did make substantial changes to the ways that agents and brokers can change applications. So they have to be already connected to somebody's application now in order to change it. But that doesn't make a difference, though, for all of the previous applications that have already been changed, right? So I have a feeling that in probably like January, February, like around tax time, when VITA programs, when the volunteer income tax assistance programs start opening up, assisters are going to see a lot of work from those VITA programs who get people who between the months of January and July 2023, and also from 2022, before the Biden administration, 2024, before the Biden administration made this change, those folks are going to have tax credits that they didn't know about. A lot of these folks got enrolled never knowing that they were enrolled in a health plan. Some of these folks are undocumented and got fraudulently enrolled in health plans. So I just think that like one thing that we will all collectively have to keep talking about come probably like January, February, is like how we're going to get through this workload of people who need to call the marketplace call center and or navigators who need to submit that complex case form to get those 1095As revoked or voided so those people can eventually do their taxes. So yeah, just a heads up that's something that I think we'll all continue talking about. And for assisters and program staff to be aware of moving forward. The 1095A voiding process will continue to be an issue moving forward, but I think especially so in 2024 for those folks who got enrolled before that regulatory change in July. Yeah, we could probably spend another 30 minutes talking about this, but let's move on. So what are some other challenges that folks on this call or also anybody in the chat are kind of like anticipating leading into the 2025 open enrollment period? Like we talked a little bit about the FTR checks restarting, talking about agent broker fraud. I don't want this to be an entirely like negative conversation, but like, is there anything else that assisters are concerned about, have any anxieties about that we can kind of like discuss here together and maybe like problem solve a little bit?
Lynn, I could kick us off. I think that one of the conversations lately, just because we have done a lot of outreach around DACA recipients, but more than a challenge, I think it's just awareness with the team because they want to make sure our navigators want to make sure that they are prepared to provide that enrollment piece to DACA recipients, number one, and that they know all of the pieces of the process, right? So I think that is one of the things that we will spend several days with our teams, making sure that everyone is prepared. This summer when the news came out about DACA recipients being able to go through the marketplace, we intensify our outreach. We divided our coverage area by zip code, and navigators started reaching out to immigration attorneys to make sure that immigration attorneys were aware and had the knowledge of this change. But now that a lot of these immigration attorneys have our information, we want to make sure that our navigators are prepared. Because we had, I believe as of yesterday, 3 attorneys asking us if we could have a navigator talk to their clients. So there's some traction going on, and I know that is something that our navigators are not worried. I don't want to use the word worry. They're just looking forward to providing that enrollment piece.
Yeah, that's a really good kind of exciting point, right? We've heard from a couple of different speakers during this conference about DACA eligibility. In addition to immigration attorneys, and Stacy, I see your hand up, and I'm coming right to you as soon as we just like dive a little bit deeper. Are there any strategies that folks have found successful in reaching DACA recipients now that they're not necessarily young enough to be connected to school age, right? Or to even like college age. Like our DACA recipients are getting to be in their 30s now, like late 20s and 30s. So anything that y'all have found specifically valuable or helpful in communicating to that population that's never been eligible before?
Well, I can say that, for us, we have an immigration program. And so we've been talking to our legal program to kind of have an idea of how we can really present the information, because we do have DACA recipients, and we were wondering how can we reach out, to these DACA recipients that we've helped in the past. And we've been doing renewals for a lot of our DACA recipients. And so that's the one thing that we're trying to do is to really provide information to our sisters so they can kind of understand, because a lot of people don't know what DACA is, even though we may have a programming, immigration program, health programming, literacy programming, but not everyone really understand. And so we all have to really provide training. And the great thing is that that's what we're planning to do, is to have a legal program to kind of train our sisters to kind of understand, well, what exactly is DACA before we can actually go and reach out to those DACA recipients, because we have to understand what DACA is and then provide them with that information and that support and let them know that we're here to help to answer questions. And whether it's they may have some legal questions of that, right? Because right now there are, quite a few things that is going on with immigration itself. And so I think it's really a matter of training our sisters to really for them to be comfortable enough to say that, I have a grasp of this. And, when we reach out to our DACA recipients, that they know that they're in good hands, and they understand the situation, and that they're able to fill in the gap of what DACA is, and then enrollment in ACA marketplace. So I think that's where we're trying to really fill in that gap on both sides. And so we're going to be providing our sisters, with some training next month on that, and just working around that, because honestly, we're trying to understand it too, with the ACA marketplace and the eligibility and all of that. And so that's not something that we can do overnight, and we have to kind of provide those ongoing trainings.
Sure. Yeah. Is there, give me a hands up or a thumbs up or whatever works for you. If for folks who are on this call, if it would be valuable for you and for your team, maybe in the next 6 weeks, to have just like a DACA 101. I see a raised hand. I see 5, 8, 9, 10. Cool. Okay, right on. I dig it. Yeah, let's I'll go back to Every Texan and the National Immigration Law Center and see what we can do in the next 6 weeks leading into open enrollment. And I know that now is training time. It is pretty much go time, heavy go time for everybody. So we'll keep it short, we'll keep it recorded so folks can revisit if they need to. But that's an awesome idea. And now, the inimitable, if I'm using that word right, Stacy Thompson, I'm going to find you. I'm going to ask you to unmute yourself. Okay. Stacy, you had a question earlier.
I'm on, Lynn. Can you hear me?
Nice. Yeah, good to hear you.
Hey guys, all my wonderful Hollywood Squares, I see you guys. We have noticed a new issue, guys. I was going to bring it up in our meeting when we meet again. We are not able to get people coming from the reentry program who has been released from incarceration, as well as young individuals, getting them verified in the marketplace. And this is not a new community that we're working with. We've worked with reentry since we started this. And this has just started in the last 4 months. And they're sending them to Experience to get them verified, and they're not being able to be verified. But guess what? When we go back to them, agents and brokers were able to get them insured. And they have no clue what they have. So when we're asking them, oh, so what insurance do you have? I don't know. Have you received your card? And they're telling us because they don't have a telephone, a cell phone number that's in their name that they can verify them with. And some of our young adults, their phones, of course, are in their parents' names. And they work and they have their own, individual application, single application. So I wanted to bring that barrier up because that's an issue. Open enrollment is about to start, and we don't want those barriers or that red tape that we're not able to get these people verified, so they're not able to get health insurance. And they're sending their IDs, all the things, and it's still taking a very long time, but an agent or a broker is able to get to them and sign them up. And they don't even know how the agent or broker got their phone numbers or information to call them. So I digress. I just wanted to bring that up.
No, you do not digress at all. You are on point every time you speak. And that is awful. I don't know how agents or brokers would get phone numbers for young people leaving incarceration unless they're just getting post-incarceration reports, which I've never heard of that coming from the Texas Criminal Justice Department. I'll reach out to TDCJ and see if we can learn anything about that. But you're right though, because the health system is complicated. An agent and broker is not giving a recently unincarcerated person the appropriate education they need to use a health plan. Maybe enrolling them in a plan with a $4,000 deductible or something, right? We don't know. Does anyone on the call or anyone attached to or anyone who's here have any specific guidance about working with people who are formerly incarcerated as far as education or using health plans goes?
I see Melissa's answer too. She said she'll get with CMS leadership to let them know. But that's two different populations. It's the young adults who are like 26, who's now trying to get their own health insurance, as well as the reentry program. So those are the two right now are being targeted. I was trying to think of a good word. So there are two different ones.
Got it. Okay.
And the young adults are the ones who are falling off their parents' marketplace account, who came to us to get their own. And next thing you know, when we couldn't enroll them or get their application completed because they wasn't able to be verified. And these are people who was born in the United States who just don't have any credit history. And they told us the cell phone is the issue because it's in someone else's name. Or when you know you're in reentry, guys, you cannot have a cell phone when you are in those reentry programs. They're in the halfway houses, and we service a few of those. And when I say in the last 4 months, we've been jumping through loops, almost excruciating pain when we come back, and they say, oh, someone contacted me. Did you send them? And we're like, no. And they enrolled them without the red tape.
That almost sounds like insurance companies, right? And I'm not here to like vilify all insurance companies or anything, but if an insurance company has a 26-year-old on their, or a 25-year-old, sorry, on their roster of insured people, then they know that 26-year-old is going to lose the coverage when they turn 26. So I don't know that the information is like coming from insurance companies, right? But I'm trying to think of like what office would have that information about people who were turning 26. Maybe it's just in public record too. Well, thank you for flagging those two focus populations for us, Stacy. Yeah, let's keep our heads together. Melissa is going to contact CMS. I'm going to contact TDCJ about the reentry population. Let's see if we can figure out where.
Can't hear you, Lynn.
Lynn, your noise went out.
Still nothing? Yeah?
We hear you. We hear you now.
You're back.
Awesome. Sorry about that. Went on a little technical difficulties here in our last session. Jeanette, were you about to say something before I went silent? No? Okay, gotcha. And Christian Valentine in the chat says that happens to Christian also. And Joe says that it feels like brokers are getting information from somewhere. We just had a family come in this week who is a very recent immigrant and just recently processed. Oops, sorry, I lost it. And somehow a broker signed them up and it's been a mess to get them straight. Our navigator said it felt like someone was feeding the broker lists. No way of knowing for sure, but it certainly feels funny. Yeah, I agree. I've turned into like Detective Lynn, trying to like figure out like where the lists are coming from. Yeah, and then Jennifer Martinez says third-party data sites have all the age and demographic info as well. And Aaron says the same. And Bertha Torres says insurance companies have their own navigators to contact clients. And then they put clients under their names or under their companies. Yeah. Yeah, that's very true. So navigators are constant, or assisters in general, really. And I think community partner programs also are oftentimes, thanks, Daniel, are oftentimes like really facing an uphill information battle. Because the work that assisters do is so grassroots. It is so based on like building trust and relationships in communities rather than getting information from whatever big institution or office and sharing it. So I wonder if we could also turn the conversation a little bit maybe to trust building. Has anyone had any great successes or like kind of eye-opening moments in the last couple of years or the last year maybe, where you found like a really maybe like innovative way to build trust among communities? I don't want to call on anybody, but if anyone feels, Jennifer, go ahead.
Yes. So Lynn, I just want to say that while we do have these challenges, we also have the other end of the spectrum that are successes, that where our community health workers, our assisters or navigators, whatever, I know they wear many hats. They are out there having these success stories. We have where consumers refuse to work with anybody else other than their navigator. If they worked with one navigator and we have a change in maybe like, service area or anything at all, they tend to want to stick to their navigator who has helped them before. Another thing about, building trust is, using promotores de salud, using using community health workers, as part of your sister workforce, because the community is really their office. At MHP Salud, we do have where we have remote work. So we are able to work with application assistance virtually, as well as in person and home visits. So it is important that the consumer knows that we are coming to them if they're not able to always come to, an office. We are also meeting them where it's most convenient. We do have partnerships that we set up with like local libraries, with local community centers. And this is very important because they see us ingrained in that community that they live in. And then we share a lot of the challenges that we see in the consumers. And, just specifically, I used to be a Medicaid, recipient. I used to be TANF recipient, SNAP, everything. So I know the challenges that go into being, having to reapply, having to recertify. And this goes a little bit beyond the marketplace, this goes into the state benefit programs. But I feel that, we provide, as assisters, we sometimes provide a 360 approach, a holistic approach. We don't only, if we encounter families that have the need for health coverage, but we also see that they don't have, access to food, or they have, food insecurities or other things that they're having challenges with. We do our due diligence in order to do those resource referrals and, get them connected with the local food bank while they're waiting for their SNAP application to be processed. So I feel that trust comes in that 360 holistic approach. And when you offer quality services, the numbers will trickle in. You know, I know that some of us are grant funded, some of us depend on the performance measures. However, when you go in knowing that your passion is helping the family and the consumer and with whatever they have, the numbers will trickle in by themselves.
Thanks, Jennifer. Yeah, when Joe and I were talking last night at the reception, he mentioned that one of the Centro Med sisters set up like a navigator education table next to like a voter registration table at like a fire festival, not like the fire festival on the island or whatever, but like with fire dancers and stuff, just like not somewhere you would normally expect to see like social services providers, you know? And then the lesson there is just like, if you talk to one person who finds you in one of these like deeply community-based environments, the word does get around, and it gets around slowly. And I think that slow build, that slow burn is what navigator organizations and sister organizations are really, really good at. Anybody can get a phone call from an agent or a broker and get like slapdashed enrolled into something, have a problem with it, find an assister, and then like feel relieved and feel trust, right? But yeah, I do think it's those like, you know, the navigator table at the fire dancing festival or whatever that really like catches people kind of like, oh, these people do really care. These people do really like know me and know where I'm at, you know? Yeah, and let me see. Christina says in the chat, working hand to hand with local and area community resources, providing a variety of services, not just ACA, but with a complete casework with linkage, coordination, services, education. We become trusted members in the community. Yeah, Christina, I think we should put that on a flyer. Just your words exactly. Yeah, Bertha says CHWs, we are the community. Totally. I want to reach out to a couple of folks who have their hands up and just make sure that your hand might be up from my question from earlier, but it might be up because you want to say something. We've got Ivy Mendez, Antonia Garcia, and one more, Joel Barrientos. So I'm gonna click allow to talk for those of you who still have your hands up. And if you have anything that you want to say, go ahead and unmute yourself. And it looks like Sonia Garcia also just put your hand up. So yeah, folks are welcome. If you put your hand up, I'll click on the allow to unmute button. Okay, cool. Thanks, Ivy. Oh, that's all good. No worries. Yeah, I really appreciate those points, Jennifer. Thanks for bringing those up. And let's see, we did make that list of questions before we got here today. We can always go to it. Let's see. There's a million tabs. All right. So what about training? How's it going? Our training programs, have they shifted in the last few years? Is anyone trying anything new leading into the 2025 open enrollment period? What's going on with training? How's it going on your end? How's training going at Light and Salt U?
So the navigator training,
Yeah.
it's going well. Because most of the navigators are returned navigators,
Oh, cool.
and yeah, so we have plenty human resource, and we are planning to hire more, recruit more new navigators. But so far, pretty good. Actually, we have already have 20 navigators certified for 2025.
Very cool.
Mhm.
Yeah, it's helpful to have returning folks.
Mhm.
Does anyone have new assisters onboarding this year? I feel like most people do. a little bit every year.
Yes, MHP Salud does have new assisters. And I think one of the challenges is the learning curve, Lynn, because
Mhm.
when we when we hire assisters, say during the summer, I feel it's a disservice to expect them to be pulling in, you know, so like high numbers as seasoned assisters during open enrollment. However, open enrollment can serve as a good training tool, you know, because you can use open enrollment as a tool for shadowing a lot of appointments, for shadowing events, shadowing outreach presentations, shadowing partnerships, collaboratives, and just, you know, being part of the team. So I'm not saying it's, you know, a total loss, but you cannot, you have to, you know, as a manager, you have to be very, very cognizant of how much can a new brand new assister help in during the open enrollment. But if you use it as a tool rather than, you know, having like a negative connotation, like, oh, you know, that, you know, we're not probably not going to be able to expect you know, a lot of the applications from this assister, but going into it as a positive, you know, note, using it as a tool to learn, and going ahead and you know, of course, we have at MHP Salud, we have a 6-week training program.
Gotcha.
The two weeks is the first 2 weeks is onboarding for the organization, and then the following weeks are program orientations and onboarding. However, we do continuous education and training. So even our seasoned assisters are also you know, like checked up on, and you know, with one-on-ones, team meetings. We also do we also make sure that our assisters are registered on RegTap, Beyond the Basics, just to name a few. Those webinars, ongoing webinars, are super uber important. I cannot tell you how important they are, but not just for assisters, but for management as well, because I feel like all the updates that we need to be the ones that, you know, understand them fully if we're going to train anybody with that material. And then lastly, we do have 2 regional trainings that we are planning this spring for our teams, and this is an in-person training. So it's amazing because we get to see everybody in person. We have 6 different regions. So El Paso, Eagle Pass, and San Antonio will get together in one place for a week. And then our other areas, Corpus Christi, Loretto, and the Rio Grande Valley, will get together for also a week in person. And we are always having, you know, like monthly meetings all together with all 6 regions. So communication is key, and staying, you know, close to your program managers, because they are, you know, what also keeps this train going, right? You know, our program managers are essential to getting the information, to important information to our assisters in our program model. So super important that we also don't forget to train our management and our leadership, because they're the ones that are out there providing any strategies to challenges that, you know, CHWs or assisters you know, encounter.
Yeah. That was such a good run through of like just a general kind of like team building and ongoing education strategy. Thank you for the specificity also, as far as like 6 weeks onboarding, 2 with the organization, 4 with the Navigator program. There's probably some shadowing that happens in there a lot with clients. I feel like shadowing is a really important component. Daniel, I saw you have your hand up.
Yeah, I just wanted to share. So echoing a lot of the things that Jennifer mentioned, but there's 2 critical things that, based on feedback from our navigators, that it is a crowd pleaser, and every year our navigators actually ask for it. So there's 2 things. Number one, our new navigators will shadow a seasoned navigator, a veteran, for 2 weeks. The first week, it's only shadowing as a viewer. The second week is hands-on. So we go through a 2-week of shadowing. But the part that our navigators are always looking forward to it is, we call it the Enrollment Fest. And we block an entire day where we bring our navigators in-house, and we have numerous stations where they will get to enroll based on the scenario. And you could imagine, from mixed family scenarios to mixed income scenarios, now we're adding DACA recipient scenarios. So our navigators will travel from station to station, and they have to enroll based on that scenario. So and we all know each enrollment is its own story, right? And each enrollment is unique. But at least during that day, they get to experience the uniqueness of some of those scenarios, and they have to travel from station to station. And our leaders, our lead navigators and program managers, are the ones that are traveling through those scenarios, presenting to the navigators. So it's an all day. We get some funding from some of our corporate supporters for lunch. We do provide lunch and snacks throughout the day, but it is one that our navigators are always looking forward to it. And like Joe said in the chat, not until you put your hands on it, that you get that, that training piece. So that's one of the days. So no, we don't like throwing our navigators to the wolves right away, Lynn. We kind of get them trained before we throw them. So, but yeah, that's one of the things that we do here at United Way, that it's always popular with our navigators.
Yeah, in my head, I was just like, it's like speed dating, but like speed enrollments, It's like if you're
That is
just like
right.
popping
Yeah,
from
that is
desk to
right.
desk,
Yeah.
That's fantastic. Also, I'm thinking in my head of just like probably all the collective scenarios that we've all used to train navigators. I feel like some folks on this call have probably seen this folder before, but in case not, it's Every Texan's Assister resources folder. It's just a Google folder that has a bunch of documents and stuff that I've built over the last like 10 years or so doing trainings and whatnot. I don't have a folder I mean, that's just for everybody's like kind of, to have that on board. The 2025 FPL chart is in there, but what I'm going to do is I'm going to go back in all of my trainings and find my scenarios, and I'm just going to pop them into a folder in that Assister resources folder. And then if anybody, if you want to go through those and if you want to use some of those scenarios, go for it. If anybody else has any training materials, or specifically scenario-based materials that you want to share, let me know. I'll put them in that folder. And I think that could be a great resource for everybody, just so that folks don't have to kind of continuously imagine the new tricky thing, because like the reality is everybody on this call is experiencing the new tricky thing when you're answering a navigator's question, when you're, working with a new CAC and they have like that brilliant thing that you've just never thought about before, which happens, I think, oftentimes with new assisters. So yeah, I'll link to that also in our conference details folder, but I'll make that a project in addition to like a DACA 101 for the next few weeks. And people are definitely celebrating the idea of Enrollment Fest 2025. So I'm not going to steal that title from you, Daniel, but maybe we could find a way to do it collectively virtually.
Absolutely.
I was
thinking, too bad I didn't copyright that.
Yeah. He'd be a 15,000 error before the end of this conversation. Awesome. Yeah. And then also, if this is helpful for anybody, on October 24th, I know timing is tight. It's a week before open enrollment, but I'm getting together plan reps. So from the insurance companies around Texas, we have 16 insurance companies in Texas this year. WellPoint is in, US Health and Life, Ascension is out. And WellPoint it used to be Amerigroup. Amerigroup has had their hands in Texas coverage plans for a long time, from Medicare Advantage to Medicaid plans. So they're not new, but they will be new to Marketplace. I haven't reached out to anybody from WellPoint yet. If anyone has a contact over there, let me know, because I'm going to get them and, Christus and Community Health First Choice and Sendero and all the First Care, all the plans on October 24th to do like a kind of a sort of like summit day that will be Texas wide though. So I definitely recommend that assisters continue having your own like kind of regional plan summit days so that your assisters can ask like very local questions to the plan reps who show up for those. But I'm also organizing on October 24th for a Texas wide one that everybody will be welcome to. And I'm going to announce it on the Open Enrollment Digest, the TOAD, also to the Get Covered Coalition. And if anybody who's on this call is not connected to the Get Covered Coalition or to the Texas Outreach and Enrollment Digest, pop your information in the chat and I'll make sure to add you to those lists so that you can get those updates. Awesome. Yeah, I love Enrollment Fest. I think that's fantastic. And also, I mean, yeah, there's definitely some folks in the chat who have maybe like whole new teams, I think like Shannon said, or like the Houston Food Bank is a new assister organization or a new navigator organization. Congratulations, Houston Food Bank. But so we do have some folks also with just lots of new assisters. So you know, we're here to support at Every Texan, and we'll follow up with everybody. So we're 3 minutes from the end, y'all. I can't believe it. If we could just go around the circle here among the 5 assister org reps who are here. What are you doing to take care of yourself and your teams leading into a really busy time period?
I can go ahead and go first. I think in general, as an organization, we are very cognizant of self-care, making sure that not only ourselves, but our team is, you know, that is part of their process as well. And part of their training, we also incorporate this into our values and what we believe as an organization. So it's part of our culture. And because it's already embedded in that, we make sure that all of us, including ourselves, leadership staff, and our teams on the ground, are part of that self-care process. We have a very generous time off process that we incorporate within the organization. We also have a very generous, and this is all with our CEO, thanks to her, that we were able to make these changes, and also a very generous time off for different holidays, so additional holidays that were added. And so we do have health and wellness. So that's also part of what we utilize in order to avoid burnout, to build retention within our teams, because, you know, burnout can lead to loss of staff. So we want to make sure that they're well and they're well taken care of. And we incorporate different things on the development process. So we have what do we call an IDP, an individual development plan, with the staff that are encouraged to have goals and self-care as well. So we are able to develop these SMART goals and divide and align them with some of the self-care process that our program managers check in with them, make sure that their goals are being met, but also like checking in on their self-care. So that's something that we incorporate and implement as an organization and part of our culture.
Thanks so much, Monica. Yeah, and I really just want to lift up MHP Salud and I know the other assisters represented here too for focusing on that year round. Open enrollment is such a tough time, you know, it really is. So we do a lot of focus on self-care and you know, for reasons like staff retention, but also of course for just general wellness. But I know that everybody also is just like really key on those like stabilizing and wellness producing strategies throughout the year also, because we got to keep folks healthy because this work is hard, and you encounter some really dire situations sometimes. Daniel, go ahead.
Yeah, just really quick, echoing, of course, what Monica said. I do believe, based on the feedback from the team, self-care looks different for everyone, right? So I think as an organization, and as a leader, I always encourage self-care and to identify what self-care looks for you. One thing that with my program managers and lead navigators, what we do is to encourage those self-care options, and to encourage breaks, right? Like to give your brain a break. We are really strong, Lynn, on setting boundaries for our navigators. That is critical. It's difficult, right? Especially when we have schedules that are flexible, right? Like we are Saturday, Sundays working, we evenings, right? But we have to find a way to set boundaries to prevent burnout, to prevent our navigators going. We don't want our navigators to leave. We want them to be in a space where they want to continue to do the work. So boundaries are incredible important. And the other thing is in many other things, right? But one of the things is to celebrate achievements. How do we continue to celebrate the achievement of our navigators, and do not forget the incredible work that they do and the incredible piece that they play in the healthcare system in our country, right? So how do we continue to celebrate those achievements in addition to everything else, and to set the time in this crazy time that we have of open enrollment, and even outside of open enrollment, there's no more slow time, right? With Medicaid and with everything else happening. But anyway, those are my recommendations. I pass it to someone else.
Thanks, Daniel. Yeah. Agreed. I think celebrations are so important. Yeah, I'd love for us to like, and you know who is really good at this? I'm going to call you out. Even though you're not on this panel right now, Joe, I feel like Joe Ibarra from Centromed tells a lot of like really awesome stories, about like that person who found that unique thing to do, or I love a sort of like breakdown of how things are going generally with like an example, like one of those anecdotes. But again, just to echo, I think everybody on this call does such a good job also keeping teams healthy, making sure they know that they're valued, not only by the communities, which 100% they are, but by employers, right? By managers and supervisors. If anybody has anything else that you'd like to add to that list of self-care, please email it to me, text it to me, give me a call. Everybody has my contact info at this point. And now that we are just about 5 minutes over, I'm going to share my screen one last time. We are going to raffle our way through 2 more $50 gift cards for people who made it here to the end. And then we've got a lot of follow-up. And when I say we, I mean like me. Like I have a lot of follow-up to do with folks after this call. The conversation does not stop at the Texas State of Enrollment Conference. Let's see here. Okay, the poll is up. Thank you, Sonia, for launching that. And I will share here. All right, let's see. And the last 2 gift card winners are, let's get it going. Chatal Ransom. Let's see if Chatal is here. Okay, not in the Zoom room, but let me check the lobby also. Okay, I don't see Chatal in the lobby either. Chatal, if you are here in the lobby, go ahead and send a quick message, and barring that, I will go ahead and we will swoop in.
For the record, she's one of my navigators
Yeah.
for the consortium. So shout out, Chatel.
Oh, cool. Thanks, Daniel. Okay, let's see. We'll do this a couple more times. And Shannon Wisby, who I know is here. I think, yeah, I've seen Shannon in some comments. Congratulations, Shannon. Cool. And last one. Let me get over here. Heather Nickel. Let's see if Heather is here. Heather's here. Awesome. Okay, well, we've got a long list. Sylvia, Jennifer, Nathaniel, Remy, Reina, Hashmatullah, Laura, Griselda, Heidi, Noemi, Eric, Shannon, and Heather. Congratulations to gift card winners. In a world where I become a fundraiser, I'm gonna get it so that we all get paid for being here. Everybody deserves to get paid for your time. This conference wouldn't be possible without the assister community here, who again, like y'all do the work. Y'all are changing lives literally across the state of Texas. The work you do is invaluable. One conference cannot support you enough, cannot celebrate you enough. But we're going to be in touch throughout the year. Like I said, a million thank yous to Jeanette, Jennifer, you, Monica, Daniel for being here, to all of our speakers over the course of the last couple of days, to Young Invincibles, Every Texan, and the Texas Association of Community Health Centers for organizing, to Methodist Healthcare Ministries and St. David's Foundation for support for the conference, and interpreters. I can't enough. Just 2 straight days. It's an invaluable resource that you provide to make information accessible and to make access equitable. Yeah, thank you to our interpreters. We'll see everybody again really soon. I've got a bunch of email addresses to add to the Get Covered Coalition. The Get Covered Coalition today is canceled because of the conference. So nobody join that Zoom call if you have it saved. But we will see each other in October, and I can't wait for then. We'll recap a little bit this conference, and we'll move forward looking to the open enrollment period. So a million thank yous again. Appreciate all so much. And we will see you real soon.